Good morning! Oh. And this is why I don't dance.
I'm just like jogging in place with spicy moves. So I get to move. The faces I make are the best. That's really good.
I mean, you have to make like a
yes.
when you do something.
Yes, exactly.
I'm glad there's no one on yet.
They'll see it later. It's all good. So, Crystal, who sings that song?
Who did? Oh God, who did it say? Rolling Stones.
Yes. And why do we have the Rolling Stones on today?
We have the Rolling Stones on today because we just did a cystotomy.
What's a cystotomy?
It's where we remove stones from a bladder.
Yeah.
We go into the bladder.
Yeah. Yep, we cut open the bladder. Because these guys. And this poor little baby. I don't know if everybody... everything's backwards.
It is, yeah.
This is what was in that little dog.
Here, you gotta do some of this.
That little dog splatter. Yeah.
Like, these are rocks.
They're they're just like little rocks. And you can see there's all different sizes. You got like teeny tiny ones. This is the biggest one. Though this is the big one that we found.
I mean, that's pretty big though.
That is. Yeah, I mean, so it's what, like about an inch?
Yeah.
Yeah. In her bladder.
So why did she present to us? Because I wasn't here when she came in.
Yeah, so actually, they called, and they had a dog that has been urinating more frequently, sometimes with blood in the urine. So that's kind of how these things are typically found. Sometimes we'll see patients that are straining to urinate, not a lot's coming out, because their bladder's all ticked off because they have rocks basically sitting in there. So we had them come in. So that's why when people call and they're like, I think my dog has a UTI, I just want antibiotics. And we say no. So this is exactly why, because the clinical signs that you're seeing at home are going to be the exact same as if they have stones. And if we just put this dog on antibiotics, for a week or 2 weeks or whatever, that would be even longer, that her treatment would be delayed and she'd be in pain for that much longer. So
tell us what can happen if we don't remove these.
Okay, well,
male, female.
Yeah, so all those rocks in there, so most of them are big enough that they can't go anywhere, so they just sit there and just take off the wall of the bladder, so it's all thick and inflamed. This poor dog's bladder wall was so thick, just because of the irritation. Just kept rubbing, and that's not comfortable, and that's why she was having issues where she was like straining or feeling like she had to go more frequently than what she really did have to go. So there wasn't a lot of room for urine in her bladder either. No,
I mean, she was only here for maybe a half an hour, 45 minutes, and she had already gone to the bathroom in her kennel. Yeah. And I don't think that it was because
she had to go that bad.
Yeah. I mean, there was no room.
There's no room, and she just didn't have a choice anymore. Plus, with that bladder wall being all thick and inflamed, it spasms, and so that's why a lot of us ladies are familiar with what a UTI feels like. That's the exact same feeling that they're getting. So it's spasming, so they feel like they have to go, even if there's not a lot really in the bladder. So one of the things that can happen is that, like this one, where it just sits there and rubs and just causes all kinds of inflammation and discomfort, and that's not good. Another thing that can happen that's more emergent is sometimes those stones, because especially when we have like little tiny ones, like these, I don't think you can even see it, or like these. So she had a bunch of these little tiny ones, and then she had, some of the bigger ones. So these little tiny ones that are sitting in there, they can try to come out. And in females, it's not usually a big issue. I'm sure it's uncomfortable.
Oh, I'm sure.
But it doesn't usually cause an issue in the girls. I saw one patient that was having an issue. It was like her body was trying to pass this giant stone, and it didn't fit out, so it was just like wedged in there and blocking the outflow of her urine, so she was very sick from that. but especially in the boys and boy cats for sure. If they get a blockage with a stone or any kind of like crystally stuff, that's a big emergency. That's bad because the body doesn't stop producing urine. It keeps filling up that bladder, and eventually that bladder can't stretch anymore. So what happens?
It's going to rupture.
It's going to rupture. It's going to break open, and now they've got urine in their belly, and that's not good. No bueno.
Yeah.
So, so those sorts of situations, they need surgery pretty emergently to relieve that blockage. So
yeah.
this
so
one
if
wasn't
your
like,
cat is trying to go to the bathroom,
especially a male cat,
and nothing is coming out, or even just like teeny tiny little amounts, definitely have them seen right away, because that, if there is no urine coming out, that is a medical emergency, and they need to be seen.
They need to be checked. Yeah.
ASAP.
Yep. Exactly, because I mean, they could potentially die from that. That's not good. It can cause all kinds of different electrolyte imbalances, which can affect their heart. So that's bad too. So even if just the bladder rupturing doesn't, put their life in danger, the increased potassium is going to. So it's all bad stuff. So that's why, we're not trying to be jerks when you call up and you just want some antibiotics. We're not, not just because we just don't feel like it, or because, we want that exam fee. No, it's because we see this happen so often, and especially with certain patients, there's common things that happen with different breeds of animals, so we start being a little bit worried about these sort of deals. Although one of our favorite patients, she is not one of the typical ones, Miss Allie.
Yes.
Yeah, she is not typical what you would think of having a bladder stone, but she did at some point. So
she was peeing out rocks.
Yeah.
I mean, she had some of the big ones.
She had big ones.
Yeah.
She's a big girl too.
Yeah,
So we more commonly see the bladder stones in the small breeds, and in cats. But any animal can get these. Dalmatians get their own very because Dalmatians are just special in general. We love them, but they have some pretty significant genetic issues and things that come up, and a certain type of bladder stone is one of those. So they can have some bad bladder stone issues, among other things.
Yeah.
And there's different types of stones, and I don't know what type this one is. We send them off to Minnesota. Has a
Go
lab.
ahead, do it.
What?
Where do you send them?
Oh,
to?
Minnesota. Don't you know? You betcha. So we send them off to Minnesota. And this is the laughing. Your mom doesn't think it's professional.
Yeah.
It's fine.
We're not professional enough.
Well, it's fine. Nobody ever thought we were. So we send them off to a lab, and they analyze the stones and find out what kind they are, because there's a few different types. And depending on what it is, there's different treatments and prevention type things that we need to do. So they can get stones because they have an infection. And that bacteria produces enzymes that make a really happy environment for the creation of crystals. Why are you laughing at me?
I'm not.
Oh, okay.
I'm trying to
You're
not
just
look
trying
so
to smile.
angry.
You're trying to not look like you're annoyed by this whole situation.
Because that's what my face does.
But yeah, so the bacteria create all these enzymes and things that then make crystals form, and then those crystals can just smoosh together and create all these lovely little stones. And so in that case, it's a problem with it having infections. And so making sure that doesn't happen again in the future with routine urine cultures and testing, and that is important. There's other ones where there's a relationship with the food that they're on and the stones. And in general, it's not like we can say, don't ever feed your dog this food, because we always see stones with it, although there's a couple. We won't say it here. If you have questions, you let us know. But in general, it's just how the individual's body is metabolizing that food, and some of the potassium or magnesium levels or phosphorus levels and things like that can all affect if there are stones that are created or not. So it doesn't even happen to every individual that's on that certain food. It's just each individual. which stinks because you can't predict that at all.
Yeah.
You
I mean,
can't.
it's the same with medications and allergies and all kinds of stuff. You know, it's very specific to the person or the patient. You know, it's difficult.
Yeah.
It's one of those things.
You never know. They're not machines. They're not robots. We can't, just predict all these things, unfortunately, because everyone's a little bit different.
Well, and that's why it's good, too, that we run blood work. The blood work panel that we typically run or recommend includes a urine urine
test.
test.
So what does it check for?
So it's going to check for all different kinds of things. If there's white blood cells, red blood cells, protein,
Looks for crystals.
Crystals, yeah.
Any other types of cells that might be in there, that's a thing. But yeah, it's different than a urine culture. So urine culture is actually, they put some urine on like one of those little petri dish little plates, the blood agar or whatever type of medium they're using, and then put it in an incubator and see if it grows any bacteria. And if it does, then commonly they'll test it against different antibiotics too, to see which antibiotic is going to be effective against that particular bacteria. So that's how, or there's no growth and then they're done. But yeah, that's a culture, so it's a little bit different. It's something we do kind of as the next step if we're seeing abnormalities in the basic urine test, urinalysis is what that's called. So yeah. That's one of the reasons. And two, especially since there's certain breeds that are prone to these things, sometimes they're not always showing us really obvious outward symptoms, especially in small breeds of dogs who like to not be 100% house trained anyway.
Yeah.
You know all about that.
I sure do.
Yeah.
Because my little dog, actually, he had crystals in his urine. We found it on a blood work where we included that urinalysis panel. And so I put him on the specialized diet. He was on that for a couple years. Yeah, it wasn't his favorite food, but he got used to it and he ate it. Yeah. And then, we double checked him later on. He didn't have any.
Yeah, he was negative for crystals. Yeah. So then we tried him off of it, and he's still been negative for crystals. So yeah, I don't know what that was about, but
I don't either. But yeah, I mean, I came in and I was like, there has to be something wrong with him. Like, he is being in my house. I think he was just mad because I had a baby and he wasn't,
He wasn't about that.
Right. He wasn't the favorite anymore. So
poor Jaeger.
He was peeing on everything. Yeah. But yeah, so I know all about the food. And all about.
And it's pricey, I mean, we know, like, if they have to go on that, if you have a patient that has had bladder stones that needs the special diet, it's pricey, but it's cheaper than more surgery. Exactly. We had one patient that had bladder stone surgery, 3 times?
Oh, at least, yeah.
Yeah, it was and
the mom was just like, well, I know all about it. Just get it scheduled.
Just do it. We'll just put in a little zipper and just
like a little coin.
Can we just open that up and just unzip, take out the stones, zip it back up. We're done.
And that dog was on the food.
He was, but I think he was getting some table scraps from the children too. So that's important to keep in mind if your animal's put on a prescription diet for any reason. That includes anything that they eat, any treats, any table scraps. They shouldn't have those things because they will mess with the effectiveness of that diet. So,
and they do make urinary treats.
They do.
So they're different, but same sort of concept.
But no, giving them milk bones.
Right.
That
or
kind
even
of
a little piece of. A little piece of meat.
I feel sorry for him, so here's some lunch meat.
Yeah.
Here's a Vienna sausage.
Yeah. No. You might as well have just put your money in a fire. Or given it to me.
Help me, I'm poor. Goodness.
We need to stop laughing.
What else do we want to say about bladders? Anything else about bladders that we're...
Are we going to post that video?
Yeah, we'll post the video.
We took a video actually removing these stones from the dog. So there's blood.
Yeah.
So if you're
There'll be a warning ahead of it, but there is
post
blood.
The link. Do we want to post the link?
Yeah, I will.
Yeah.
Yeah, I can post a link in the comments. That's fine.
So we'll do that. If you're squeamish, don't watch. But it is really interesting.
Yeah.
And they just keep on coming out.
They just keep coming. Yeah, and I'd already gotten a couple scoops out, and Crystal was like, we should get a video of this.
Yeah.
So we were already part of the way there when we started, but they just kept on coming. They just got on coming.
Show them again. There's more people on now. They're bladder stones for those of you that are just tuning in. I mean, we talked about making some necklaces.
So creepy.
I mean, look at it.
Yeah, nice little earring. Yeah. That's disturbing.
Yeah.
But yeah.
We also do we have anything else to talk about? Bladders?
I don't think so. I think that's all I got.
We have another announcement.
Oh, yeah. She's ignoring us.
We're welcoming a new guest.
She's doing real work.
Well, that's overrated.
Unlike us. I'm just going to crowd you a little.
Come on in.
Come on in.
This is
hi.
Amy.
Hi.
She is our new technician. We have another one starting.
Yes.
Tell us a little bit about yourself.
I've been in veterinary medicine for 20 years. I graduated from Jeffco's vet tech program 16 years ago. Pretty much the last 10 years, I've been doing pretty much emergency. So back to private practice.
Yeah.
It's a little bit different. A little bit not as crazy.
Yes.
How awesome we are.
Oh, yes. And these guys are awesome.
Goodness. Yeah. Amy is about 300 years old, just like I am.
I am.
So.
I'm pretty old. Yeah.
Yeah, they're almost the same age.
Yeah, I'm like 300 and, maybe 299, but up there.
And I'm like 301.
Yeah,
so.
same. We're close.
I'm just the baby.
Yeah. You are. For like a minute.
Yeah.
Yeah. And then our other new person is even younger than you. So.
Yeah.
Ha!
Yeah, she will
You
be
won't be the
starting
youngest
next
anymore.
week.
So yeah. I think that's all we have for today.
Yeah.
If
If anyone has questions, just drop them
We share
wherever
brain.
they are.
It's fine. Wherever direction. Because the camera is opposite.
Crazy.
It's opposite. So
Oh.
on our screen it's over here, but I have to point this way.
Ah.
It's weird.
Well, I don't know. Maybe it's completely different for them at home.
It could be.
We don't know.
Who knows? Tech savvy.
IP address.
IP address.
Your
Yes.
internet points.
Yes. Use your internet points. All right, everyone. Have a wonderful rest of your day.
Bye.
We gotta go. Bye.
Oh, you gotta get your hand in here.
Oh,
Oh, yeah.
bye.